Renal cell carcinoma comprises 85% of kidney tumors, with the majority characterized by clear cell histology. Risk factors include smoking, obesity, and hypertension, as well as familial syndromes such as von Hippel-Lindau. 60% of patients with renal cell carcinoma present with gross or microscopic hematuria, and a flank mass or abdominal pain is detected in 30% of cases. This classic triad of flank pain, hematuria, and abdominal mass was found in only 10% of presentations. CT with IV contrast is the imaging study of choice. Perineoplastic syndromes can also be seen, including erythrocytosis and hypercalcemia. The mainstay of treatment of renal cell carcinoma is a radical nephrectomy, which includes resection of the kidney, perirenal fat, regional nodes, and ipsilateral adrenal gland. Partial nephrectomies can be performed for some early cancers or when preservation of renal function is necessary. Tumor that invades the vena cava is not a limitation for resection, and tumor thrombus should be removed with the resection. Bladder cancer is the second most common urologic malignancy, with the majority of tumors being transitional cell carcinoma. Hematuria is the presenting symptom in 90% of cases, and evaluation should include cystoscopy and transurethral resections to determine the extent of disease and if the bladder must be removed or can be preserved. Tumors confined to the mucosa or submucosa can undergo transurethral resection and intravesical chemotherapy. Muscle-invasive disease requires radical cystectomy, pelvic lymph node dissection, and urinary diversion. Testicular germ cell tumors account for the majority of testicular tumors and are characterized by two histologic subtypes, seminomas and non-seminomas. Cryptorchidism increases the risk of testicular cancer in men. Testicular tumors often present with painless enlargement of the testes. A testicular ultrasound can confirm the presence of a mass and determine its location. Biochemical markers such as LDH, AFP, and beta-HCG should be assessed. A testicular biopsy should not be performed. Instead, a radical inguinal orchiectomy is the diagnostic and therapeutic procedure of choice. Staging is complete with chest, abdomen, and pelvic imaging, and adjuvant therapies include chemotherapy, retroperitoneal lymph node dissection, or radiation therapy depending on the tumor's subtype and stage.